work in any kind of industry, and the healthcare is an industry, people who work in it do so because they love to be there. And often they love to do things just the way they're doing them now. All of us are like that. And they're not going to change unless there is a really big reason to change. However, you can get yourself in a real mess if you then blithely go ahead without having thought through what the outcomes are actually going to be of your changes. And if I might comment on, with the great experience given by 2 days in the UK, but I am an FT reader, so I have been keeping track of this debate, that trying to both reform and cut at the same time, when you've given a political promise that you're not cutting, is an extraordinarily difficult position to be in. And I think that what the Canadian experience shows is that one of those at a time is hard enough. However, you've got to have the vision for where you want to go clearly up front at the same time as you're finding the least bad way of reducing the costs in the sector. It's not like Canada's home free. There are great concerns about the sustainability of Medicare. Canadians are completely wedded to a single-payer, publicly funded, tax-based system. They are not diverted by the blandishments of those who say, oh, a little bit of private here, a little bit of private there, doesn't matter. Canadians don't actually believe that. We've had public opinion polls since Medicare came in that show that. But they do want good treatment. They don't want to wait a long time, and they do want to feel that providers are actually focused on them and not on themselves. So we've still got lots of work to do.
What role does evidence play in all of this? Because sometimes these reforms almost just sort of need to take place because change is needed, and you can't wait for the evidence base to come through. You just have to take a leap in the dark.
Well, then what you do, virtually every government makes a decision based on less than full evidence. I've never seen, I've been in government for a very long time, I've never seen just the right facts and analysis on the table for cabinet. However, evidence has a way of permeating society. If you do a good analysis and you talk about it long enough, it may take you 25 years, but views do change. And it's those views to hand which inform most of cabinet decisions. It's very rare that there is just the right piece of analysis ready and before them. So that's why we have a duty to keep a focus on evidence, but we need to be realistic that people are not going to be saying, what a brilliant report, I think we'll do that tomorrow. That's not how it works. But the more people who are able to understand what the numbers mean, what the analysis is, who to call, who is it that has been thinking about the problem, and getting the people who've been thinking about the problem around the table matters. But at the end of the day, it's political courage and political courage to face the realities that the services you're responsible for are going to be ruined more by doing nothing than by doing something, even if a lot of people won't like what you do.
What's going to drive change in Canada now?
This is a really good question because we're coming up to renegotiations of the transfer payments. And there is not a sense at the moment. There are a couple of worries. One is that the amount of money going into the sector will continue to increase, because that is not usually a recipe for change. If the money continues to go in, the danger is that we will not press on and improve primary care. We will not press on and do the right thing. We will kind of just continue on as we all like to do in our comfortable patterns, earning our nice salaries. It's quite possible that will happen. And then be rudely awakened a decade hence. That's why it's so hard for people who believe everyone should do the sensible thing to amass the numbers and say, you really are, even though you don't feel it today, heading for a cliff. I don't think that there is a sense of urgency in Canada now about this. There's a lot of talk. Every now and again somebody says, oh my goodness, it's an aging population, that's going to sink our system, the comorbidities will do us all in. Well, that's actually not true. That's not true, and the research shows that. But having said that that's not true, there have to be better reasons than that for moving ahead. But the tendency to avoid questions, when you've got lots of other things that are pressing, the tendency to avoid difficult questions is very great, just as it is in our own personal lives. We often don't do what we ought to do because we're not really pushed. So the question for Canada is, in the absence of pressing fiscal calamity, will there be the political energy to invest in making what is an okay health service a really good health service?